What's up, my friend? This week, I'm going to give you an update of what's been going on since May 17th, 2021, when my wife had a brain tumor removal started at Johns Hopkins University. My life has changed as I've become a caregiver, and it's been a horrible, just a terrible time these last 90 days. I'm going to share the whole thing with you as best I can remember it, if nothing else, as a journal. While you're waiting for the world to change, it has already moved on for me. I am waist deep in it. I'm fighting fear, frustration, fatigue, and it's testing my faith in myself. So what is going on in the Blanchard household? All that and more coming up next. At the time of this recording, I'm going to tell you that my wife is doing comfortably. That's what I want to say for the remainder of the day. I am convinced that most of us don't know what to say most of the time. That's a pretty bold and brash statement. But I'm learning. I'm learning that when people pass on, when they die, when they leave this life, we don't say the right things. When somebody is ill, convalescing, in rehab, or in a bad way, we don't know what to say. And if we did, it would mean that we had a lot of practice at it, and maybe it wasn't sincere. So it's a two-edged sword. While you're waiting, the world has turned, the day has changed, the seasons move on. And this week, I'm going to give you an update of where I've been for the last 90 days. Right now, my wife is comfortably laying in bed in our house. She is hooked to a feeding tube, being fed through a little machine. She cannot speak. She can't stand. She has activity of her limbs, but they're weak, and we're trying to work on keeping them from atrophying. She has some lingering cough from the pneumonia she had 2 weeks ago. The x-rays said that the lungs are clear. We're getting physical therapy, and we had speech therapy once. Still need to clear her mouth up. It's still from lack of use. You can't imagine the bacteria and the stuff that happens in your mouth when you're not using it and there's no saliva there. So that's an active thing we're doing. No fever. Blood pressure is normal. She's on 2 medications to prevent Parkinson and seizures, but they make her like a heroin addict. She's kind of loopy. And every once in a while, she does something strange. Like a couple days ago, she rang the bell at 2 o'clock in the morning. I guess just to hear it. She didn't realize that she would wake me up, because that's why I put it there for emergencies. And then about 3:15, she did it again. And I was tempted to take the bell back and send it back to Amazon, but I didn't. I know she didn't know what she was doing. And sometimes she's like a 5-year-old. And other times, she's my wife again. She's back. I'm watching us have to change her and keep her from removing the diaper and going through some scratching and itchy fits like a little kid. And then I take that as, all right, I got to clean her better so that she doesn't itch. I must have missed a spot or something. But I know her, so I learned her eye language and her smirks and her smiles, even though her mouth looks like she had a stroke. Just a little sometimes. Usually after the medicine. She looks more like a stroke person than when it's gone through its thing. She moves a lot. Spins more than I want her to with that tube coming out of her stomach. The letters and the cards and the calls are coming. There's always an abundance of friends and family that are checking on her. And on me. But I don't have the right words to say either. I can't say she's fine. I can't say, oh, she's great. I usually say she's improving, which is true. If you put your fingers together and if you're going to say just a little bit, she's improving just a little bit every day. And that could be anywhere from not having breaks in her skin or skin clearing up or her teeth are getting better or her eyes looking clearer, or she's standing more on her own in the bed, sitting up more on the bed. She's kicking her feet different ways, She's getting stronger in her arms. It's always just a little bit. I have never cared for anybody before other than my kids, and I realized that my wife and my daughter must have done most of the taking care of my son, because I don't remember any of this stuff, and it's been challenging. Moving furniture around, cleaning up blankets, washing clothes, washing soiled papers, not soiled papers, but soiled linens and all that stuff, constantly trying to keep the house clean. Oh yeah, and I'm still working. The boss has gracefully or graciously allowed me to telework a little longer, even though after the pandemic, our offices are going back. People are working back in the office. So I have a few more weeks of just telework before another challenge will come. We have a nurse that appears probably once a week to make sure that she's still living. Not much else. They check her vitals. They give me commentary. In the beginning, they were a day late and $1 short. She arrived before they did. I got a lot of OJT through trial and error, a lot of panic. Then I have another nurse that's a licensed, what's it called, practitioner, whatever nurse that can give prescriptions. But she came from a hospice place or paleontology care or some word I still have yet to realize. But basically I call her the death nurse. Whatever she's talking about is always to put my wife in a home to count the days down before she's gone. She has like this somber tone that at first I was getting ready to get rid of her immediately. But since she's so anti-life, anti-comeback, so negative in so many different ways, it makes me fight to prove her wrong. We had a nice debate of medical opinion yesterday, and she called the doctor. That's a whole nother story, and I'm going to get to it, who agreed with me. So I knew I was getting my license as a practicing nurse and a caregiver on the fly. I'm doing pretty well. So how do I get here? Well, probably 18 months ago, my wife retired, and she had time to sit still and plan and plot about what we're going to do and spend our money in our retirement, what we're going to do, and if we're going to move, how life is going to change or not. But she started having headaches and migraines and phantom pains all over her body and bruises, and started having like hives and scratching. There's a whole bunch of internal stuff that nobody could figure out. So she went to a different a different family physician who gave her all the blood tests. I mean, she must have had a test every week. Like, how can you get poked so many times? But her cholesterol was this, and her high blood pressure was that. And she didn't have any high blood pressure. She didn't have any diabetes. She didn't have any ongoing symptoms. So they thought, all right, maybe it was just in her head. And I was thinking the same thing. Until sometime in April, she says, something's wrong. I just know it. So we went and found another doctor, an older doctor that she had before, who said, okay, let's just be safe and order an MRI. The MRI found that she had a lemon size, a small grapefruit size tumor, meningioma, non-cancerous, in the front of her head. Yeah. So we're shocked at that. We're scared at that. At least they said no cancer. So we sought a brain surgeon. We live near Baltimore, so we're going to go to Johns Hopkins. You know, that's the number 2 hospital in the country, or something like that. The tumor could be removed without cutting her skull. They're going to go through a nasal cavity and roto-rooter this thing out. 3 or 4 days in the hospital, a week or 2 or 3 weeks at home recovering, and then she should be good to go by July. She can go back to work, find some meaningful employment, and then buy all that stuff she was plotting and planning about. That was the plan in April. It's still COVID time, so a lot of COVID tests, a lot of rides to the doctor, a lot of pre-stuff you had to do. And May 17th, we had the first surgery. I say we because we're in it, man. We're in it deep. Anticipation and fear and all that. The doctors worked on her head, probably 10, 11 hours, and did not remove the tumor. They said in all that time, all they did was prepare to make a pathway for the surgery, which is going to have to come later. There was a whole bunch of, stuff they had to cut away and burn away and get out the way and make a path. Sinus cavity stuff. They made it sound so easy to do. They said, we're going to let her recover a couple days, send her back home, and then schedule another day to come back and actually remove the tumor. And it sounded good. We're all good. Except for her health started to decline. She started sliding down. She looked as if she had a stroke. There was some issues. This tumor, now loose, was moving, was fighting back. So they had to put her in ICU. They had to give her a transfusion. It was looking kind of scary. They arranged the surgery, the second one, and removed 98% of the tumor. But her health continued to slide. She had an infection they couldn't figure out. They brought in infectious disease specialist. It was still, and is still, the time of COVID, so everybody's wondering, because she didn't have her shot. So what's going on? A crowd of doctors came in with notebooks to study her as she looked comatose in Johns Hopkins. Going to the hospital, I learned about staff, nurses, techs, cleaners, and all the people who come in on their shift every hour to do things in the rooms. And the patients are just there. You won't get much rest because there is constant number of people coming in and out. There's somebody just to clean the floor. Then there's somebody who will remove the trash can. Then there's somebody who will restock the supplies. And then there's the nurse. And then on her shift, there might be an intern. And then there might be a doctor. And then there's going to probably be a food person who's going to come in and take the food away. It's just a constant barrage of people. And you're just there. Not dressed real well, not in your right mind, vulnerable to the world, and you're just there. And some of the people are real kind, some of them are real compassionate, and some are not. Well, we had that good government insurance, Blue Cross Blue Shield. I thought it was golden, but it is not. It still has some limitations. After 30 days of being in Johns Hopkins, and her prognosis or her ability to walk and be on her own had diminished. She looked like an 80-year-old lady laying in bed. People would say, hey, how's your mother today? I'm thinking, that's not my mother, it's my wife. Oh, I'm sorry. So the boot came. They're going to kick her out of this hospital and we're going to send her to a nursing care facility, and hopefully we can find a rehab that can give her occupational and physical and speech therapy to get her back. So social worker gives us a list and says, choose one of these places. Now, there's a spot about 3 miles from my house. And after riding all the way to Baltimore for a month, it seemed like a good idea, except for that was like the number 10 on the list of good places. They don't really have a Yelp for nursing care facilities, but they couldn't if they even tried, because you can have a place that's crappy but have really good people on the shift, or really good people in the season, and then they move on. And then you could have a really nice facility with really crappy people who are just, it's their turn to be there when you're there. It's a roll of the dice. So we chose a place we thought might be top of the line. They had a bed available if we would act now. So we picked a place, probably about 14 miles away, if it was that far. And it was a really nice nursing facility. Rehab, not so much. My wife sat in this room for almost 4 weeks. Rehab was little. She looked like a comatose person. Her skin was dry, ashy. She looked bad. And people would ask, how's your wife? And I would say, yet holding on. At the end of those 20-some days, She got the boot from that place. They said, all right, on July 4th, her time is up. She has to go. I said, but she's not rehabbed. She can't walk. Well, that's just the end of your calendar year of care. So she has to go back home according to the contract you signed. Oh, thank you very much. But there's a holiday going on, so there's nobody here to discharge her. So we got some people that will sign this thing off and we'll get her to your doorstep. I said, but I don't have a hospital bed yet. I don't have that machine that feeds her. I don't have all that stuff. Oh, well, maybe we can have them wait a couple hours until they get an emergency truck out there or something. I said, I don't care what you do, but make it happen. You wouldn't think that would be the case with how you have to be. But that's what was happening. Well, on the 12th hour, we got a call from the nurse. A nurse I'd never heard of before, who said, we're not going to release your wife because she has pneumonia. We can't release her in this condition. So she's going to be here probably a couple of days. I said, okay. Now, nobody wants pneumonia, but I took that as a God move. We got the delivery of the bed, which of course had a fault. Something was wrong with it. We had some equipment come when I wasn't home yet, and they had to reschedule. But everything got here before she did. I cleaned the room. I changed everything around. I moved beds from downstairs to upstairs. A lot of logistics I did by myself. When she arrived, she had a place to go. I wasn't really sure, wasn't really strong, wasn't really positive on how to use the equipment, how to medicate her, or anything. Got a call from a nurse that was about to go on vacation and said she was in the area. If I still needed her, she could come by and help. And I was like, please, please, please. I don't care if you come at midnight. It's more than I have right now because I don't know what I'm doing. She came, gave me a tutorial on the machine, made me feel a little bit better before she departed for her trip. I didn't give all the medications that came because I wasn't sure if they all went together. There wasn't much of a handbook or anything. I know there was seizure medicines and some other stuff, and I didn't know what went with what. Like, why was there 5 bottles of Tylenol? Stuff like that. And in about 48 hours, I got a chance to meet a nurse who had her stuff together. She came in and made her presence known, took her vitals, made it, and her assessments. Talked about the team that was coming, the speech pathologist, the physical therapist, the occupational health therapist, that they were on their way and they'll be making schedules, and I will meet them soon. Whoopie-doo. I'm still here. There's still 24 hours in a day. I'm still struggling to change the diapers and turn my wife over. And there's a technique to all the stuff that people do that I had to learn. It was not cool at all. And I was worried that I would kill her. Small thing, right? She's in a compromised health condition. There's like some drugs here. There's like some stuff here. Nobody seemed to care. But I'd call, the emergency number that the nurse gave me. And their answer to most of it was, if this is an emergency, dial 911. My daughter has been here with me. And in the beginning, it was a tag team effort. We were trying our best to do the best we could. And we got her skin looking better. We got her cleaned up a little bit better. We learned by mistake, flaws, and trial and error, that's the word I want to use, on how to turn her better, how to move her better, and I got her into the chair on my own, using brute strength mostly, trying not to hurt her. And she straightened out like she had a seizure. It scared me. So I called emergency people, and their response was, is she on seizure medicine? I said, yeah, I have it, but I haven't given it to her. Oh, you got to give it to her now. Okay, Captain Obvious. Well, now she had a sore leg. Her leg wasn't locked into place. And I called all the nurses And they said, well, somebody will be out, this is Saturday, will be out Sunday. Nobody came on Sunday. They'll be there on Monday. I think they came Tuesday. And then the nurse did some assessments, said they were going to take an x-ray, massaged her legs, saw that there was pain in the joints. Now that she was on the seizure medicine, she started to change. She looked better, actually. Hooked her back up to everything I could think of that I was missing before. The drugs made her loopy. The therapist also got her to move her legs. We changed her position of her bed, which bent her legs, and within about 3 or 4 days, she no longer had pains and that problem in that leg, could move it again, and the threat of a seizure was over. I've had some sleepless nights. I've had some short nights, a lot of short nights where between 2 and 4 o'clock, I'm changing her, I'm moving her, I'm checking on her. She's still coughing every once in a while. She might roll over now, forgetting that she's connected to a gastro tube. She might almost fall out of bed, which she almost did once. It's been interesting these last 3 weeks. Oh yeah, and her primary care physician, her PCP, he didn't know that she was in rehab. He didn't know her situation. He thought she was fine. So I had to connect all the dots there and get him back involved. There was a disconnect between this visiting nurse group, the rehab care facility, and neurosurgeons. Nobody was talking. I've had a great outpouring of friends and family, though. I share little bits on Facebook, on Instagram, on YouTube, and my friends have responded in kind. A lot of them have volunteered to come and sit with my wife. Even her closest friends want to do that. Family volunteered. But I don't need a house sitter. I'm really specific. I know I need somebody who has some medical care to do what I cannot do. Because I won't feel good if I go anywhere and I come back and my wife has been taken to the emergency room, where it's like the purgatory for sick people. You could be there for 6 to 12 hours in a hallway on a gurney. Yeah. Have you ever been there? If you're not bleeding, they put you to the side. My wife's in really stable condition right now, and I know that if she had to go to the emergency room, it would set her back if it wasn't life-threatening. Then my friend Nick, who did a really cool thing, he started a GoFundMe because the bills started coming in like, they would, right? The rehab place said that they were not going to pay for, our health benefits, wasn't going to pay for those 2 days that she sat without coverage from them. So that bill came yesterday. That was like $1,100. And what else happened? Oh, it's just been gear, stuff you had to buy that, like we had the wrong size diaper. Had to go out and get the right size diaper. Just little stuff like that. And the GoFundMe thing has helped so much that I just write the check now. The money's in the bank. And my friends and family have blessed me with that. That's just been too cool. Because that could have been ugly. And you should have seen a stack of paper that Blue Cross Blue Shield sends you is scary. It's scary. So we're managing. And to date, my wife is resting comfortably. She's doing everything but standing, swallowing, and talking. But we can communicate. She can't eat yet, except for through that G-tube. Her cough is barely there. Just every once in a while, if she forgets to sit up straight, she might sink down in the bed and lay on her side. She might start coughing. We're working on getting her mouth cleaner, getting rid of the bacteria. We're brushing it now and trying to get the tongue moving and having her mouth open, because her mouth doesn't want to open all the way. There's so many things that you take for granted, involuntary motion, that she doesn't have. It is my prayer that I remain strong and I don't poop out. My limbs hurt right now from the times I have to curl her and pick her up. Back is holding out. I used to deadlift. I fell on my coccyx the other day, putting on my shoes, so my tailbone hurts. But I feel like I've just been in the gym for the last couple of weeks, and that's not a bad feel. I am praying for her complete recovery. Because wait, there's more. The Johns Hopkins doctors hit me back up about a week ago and told me that they want my wife to come back to the hospital for radiation to radiate the remaining bits of tumor, which was aggressive, which will regrow unless it is killed. They don't want to leave it in there. But now because of her condition, they're going to wait until she's stronger. So they're hoping in 3 months. Sometime in October, we will do 30 minutes of radiation 5 times a week for 30 days to eradicate this tumor once and for all. And hopefully, the only thing that happens is she might lose some hair around the surrounding point of the radiation and nothing more. But they've been wrong on just about everything else. So I'm keeping my faith in God, who's been holding me firm so far. In other news, I've created the Blanchard Network at BlanchardNetwork.com. I've always had a network, just never made it formal. I started off by asking a friend of mine to create a website that I could post all my podcasts and show notes and links on it. I didn't know whether I was going to make it KenBlanchard.com or what. And he says, what you're looking for is an HTML site, not what I can do. I thought, oh, crap. But, within about a week or two, somebody invented it, exactly what I was looking for. So I took a risk and migrated all my stuff over there and even asked a couple of new people to join me that had different shows that I could produce for them. So now we have Indian Motorcycle Radio. My host is a lady named Teresa. Teresa Uncaged is the host of Indian Motorcycle Radio. I have Guns and Cornbread by Larry Case. Still have Black Man with a Gun. My son's podcast, Warrior Cast, pop culture and MMA and UFC and all that good stuff. His World, martial arts, Warrior Cast. And this show, which is a hodgepodge of whatever that I almost got rid of, but I thought, oh, let me just keep it. And then there's Speak Life Church, my inspirational Christian show to evangelize, to encourage, and share the gospel. It's an online church ministry, active since 2018. Take a look at BlanchardNetwork.com and check out my work, see what I've been doing over there. Well, that's it for this week. That's it for now. Just wanted to give you an update on what's going on in my head, and this is a journal, another podcast by your friend and brother from another mother, the Reverend Ken Blanchard. I don't know what you're going through. I don't know what you're waiting for, but you ought to live. I'm not saying being frivolous and acting like you're going to die tomorrow, but I'm saying a lot of people are just existing. Be purposeful and enjoy the life that you have. Just in case nobody has told you this today, I love you, and there's not a damn thing you can do about it. Until the next time you hear my voice, shalom, baby.